This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, and welcome to the Neurology podcast. This is Howard Goodkin from the University of Virginia. Today, I have the pleasure of speaking with Fred Lado from Northwell Health about the National Association of Epilepsy Centers' newly published Guidelines for Specialized Epilepsy Centers. Fred, welcome to the podcast.
Thank you, Howard.
Fred, most of our listeners are not going to be epileptologists. Can you tell us why they should be aware of these new guidelines?
Neurologists, as you know, are really the front line of care for individuals with epilepsy. And I think a general neurologist can approach these guidelines with really two perspectives. One is the guidelines are something of a synopsis or summary of the resources that epilepsy centers can offer patients, and neurologists should be aware of that. But even more importantly, the origin of the guidelines is that they're really a picture, a multidimensional picture of the needs of individuals with epilepsy. And so these patients, when they are in a neurologist's practice, I think it's important to understand that it's more than just taking care of seizures, that there are other comorbidities, there are other needs that they have, maybe as simple as care coordination or access to medications, or as complex as behavioral health issues, and certainly drug-resistant epilepsy. I think for the general neurologist to look at these, it would be important to realize that if you have patients in your practice who are still having seizures despite trying appropriate doses of seizure medications, these are candidates who can be referred to epilepsy centers, and these guidelines give you an idea of the services that epilepsy centers can provide.
Thank you, Fred. I agree, and I think I want to emphasize the point that in these 52 recommendations that there are good pearls for the neurologist as well as the epileptologist to assure that our patients with epilepsy are getting the best care in any practice. But that being said, if I were to refer one of my patients to a comprehensive epilepsy center, what should I expect from that comprehensive epilepsy center that improves upon the care that I can provide as a neurologist?
So obviously, referring to an epilepsy center, your patient will be seen by an epilepsy-trained neurologist. But that's really only part of the referral. Epilepsy centers also bring together a broad set of diverse specialists, other physicians, surgeons, radiologists, non-physicians, social workers, all focused on caring for patients with epilepsy. And the services available through a center go beyond simply the outpatient consultation, but it may include diet therapy. There'll be mental health screening, genetic testing and counseling, care coordination, just to name some examples. So that's really what you can expect when a patient's referred. In practical terms, most of these referrals will begin with a consultation with an epileptologist. They'll often include an evaluation in the epilepsy monitoring unit. For many patients, that may result in a recommendation for a change in medications, often going to some less commonly used medications. And then from there, patients will be discussed in a multidisciplinary conference, bringing together diverse specialties. And surgical treatments of epilepsy can be considered, as well as minimally invasive types of surgery and neurostimulation devices that can control seizures. So I think we try to take care of the whole patient, and hopefully a neurologist referring a patient to an epilepsy center will have a good communication and get an idea of all the different services those patients have available.
Fred, I know that the National Association for Epilepsy Centers also accredits these comprehensive epilepsy centers. How do these guidelines play into the accreditation process for the NAEC?
It's an important distinction that the guidelines are different from accreditation. Accreditation standards are standards that centers have to meet to receive accreditation. And the guidelines are a roadmap that the NAEC will use as they update and modify accreditation standards to reflect the highest levels of epilepsy care. I think for the referring neurologist, it's important that the center that you send your patients to be an accredited epilepsy center. The NAEC accredits what we call level 3 centers. These are centers that provide medical care of patients with drug-resistant seizures. and level 4 centers, centers that provide surgical and medical care for drug-resistant epilepsy. The guidelines in this publication are not all going to be implemented immediately. They're going to be phased in over several years as we sort of work out ways to write accreditation standards for them. And so the process of accreditation is one that's really ongoing. Centers really update their accreditation every couple of years, and that shows compliance with the highest level of care.
Over the next several years, if I understand correctly, then if I were to look at the guidelines, I would expect a level 3 and level 4 center to be meeting these guidelines.
That's correct. Over the next few years, I think we don't want to alarm anybody that these standards are changing immediately, but they will be phased in over several years.
So genetic testing is becoming increasingly an important part of epilepsy care and the evaluation of people with epilepsy. Are these guidelines, are there anything in the guidelines about genetics or genetics testing? What should be expected?
Well, these guidelines, this update to the guidelines, really are the first ones that include recommendations around genetic testing. And I think, as you point out, it reflects how important genetic testing is becoming in the care of people with epilepsy. The role of genetic testing, it can be fairly broad. We certainly have data now that tells us that genetic testing can help us predict which patients are less likely to do well with surgery, for example. And we've had a clear idea that genetic testing can outline etiology in patients with developmental disabilities and epilepsy, or where there's early onset seizures or a clear family history. Increasingly, I think genetic testing is also pointing to a way of choosing anticonvulsant therapy in some cases, that some common anticonvulsants may not be a good choice depending on genetic etiology. With each passing year, this environment is becoming more complex. We're seeing it coming into the guidelines, but the other part is that often knowledge of genetic testing exceeds what any one physician has absorbed in the course of their training. And so one of the guidelines is also that centers should offer genetic counseling services to patients as part of genetic testing. And that's in order to really give the fullest benefit of that information.
So Fred, as you know, I'm particularly interested in seizure clusters and status epilepticus. Do the guidelines include any recommendations regarding patient education in the treatment of either of these neurological emergencies?
The current guidelines really ask that all patients receive seizure action plans, that they receive education related to their seizure disorders, and that education really should cover seizure precautions, of course, as well as triggers, importantly, seizure first aid, and then also the role of rescue medication, particularly in forestalling status epilepticus.
And I'm assuming part of that education also includes SUDEP.
So we have a specific, one recommendation also specifically calls out the importance of education around SUDEP, particularly steps that patients can take to reduce the risk of SUDEP. So we increasingly recognize the importance of that.
So anything else about the guidelines that you think are important to know?
I think the single most kind of important thing about the guidelines is that they really are a synopsis of the multidimensional needs of individuals with epilepsy. And so they really should be read from that perspective, as well as the perspective of what resources epilepsy centers bring to bear in the care of patients with epilepsy.
Thank you, Fred. I just want to briefly touch on the process used to develop these guidelines. As a first question, can you tell me who these 41 stakeholders were?
Yes. In fact, Howard, I think that was a real strength of this process. There were a total of roughly 16 or 17 epileptologists or neurologists, 4 neurosurgeons, 2 neuroradiologists among the physicians. But there were also significant other non-physician groups. We had 2 neuropsychologists, 3 EEG technologists, 2 nurse practitioners or nurse specialists, an educator, we had an administrator, and most importantly, we had 7 individuals who were persons living with epilepsy or caregivers of someone with epilepsy. And I think that gave us a very rounded view of what patients need.
I'm interested in learning what you learned from going through this trustworthy, consensus-based statements process.
So the process itself really is built on the diverse panel that we just spoke about, and then draws on what evidence there is to inform the development of guidelines. The process recognizes that you don't always have evidence where you need it, but you do often have clinical experience. And so it's a way for the panelists to bring clinical experience in. And I think the thing that surprised me the most was that often the voice advocating for patients, apart from patients themselves, were some of the people who have a great deal of contact with patients, but we don't always turn to for their clinical impression. I'm thinking specifically of our EEG technologists who spend a great deal of time with patients, were often the people who could best articulate some of the patient's feelings at a particular moments in the care cycle. And that was a very important voice, and one of the really positive things that came out of the process is that you realize how hard the whole team is working to try to provide the best level of care.
Well, Fred, it's been such a pleasure speaking with you today, and I want to thank you and all the members of the panel who have provided their time and their effort to creating these new guidelines that I think will do much to improve the care of patients with epilepsy.
Thanks, Howard.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.